Hello, my name is Dr. Robert Findling. I'm the Director of the Division of Child and Adolescent Psychiatry at University Hospital's Case Medical Center and a Professor of Psychiatry and Pediatrics at Case Western Reserve University. In this blog, I'd like to talk a little bit about the upcoming annual meeting of the American Psychiatric Association, or APA, that will be held in San Francisco. Now, although this meeting is not specifically geared for child and adolescent psychiatrists, there are certainly events on the scientific program that should be of interest for clinicians who work with youngsters and youngsters' families. Now, the first thing I probably really do want to mention in this posting is the poster sessions, or are the poster sessions. Personally, the posters are my favorite part of any scientific meeting. New research is presented, so attending these poster sessions can help clinicians both remain up to date, but also help ensure that their practices are evidence-based. Another thing I like about the poster sessions is that the poster sessions give me the chance to learn at my own pace. In addition, it also, the sessions allow me to really focus on those topics that are both most pertinent to me and my patients. I can take more time to dwell on topics with which I'm not familiar or that I'm having a hard time grasping, while more quickly moving through those topics that may not be pertinent to me or my patients, or quite frankly, topics that I'm already reasonably familiar. But perhaps, personally, the best part of the poster sessions for me is the opportunity to interact with the presenters. If I have a question, I can ask it, and if there's something I don't understand, I can inquire about it. So clearly, I highly recommend the poster sessions to folks who perhaps don't always attend them. Now, besides the posters, there are several other happenings at the APA that are probably of interest to folks who take child and mental health practice as part of their day-to-day professional lives. I'd like first to mention a symposium or a course, pardon me, that's being chaired by Kimberly Stigler and co-chaired by Dr. Alice Mao. Now this course will focus on autism spectrum disorders throughout the lifespan. And this course that also really pays attention to the diagnosis, assessment, and treatment of autism spectrum disorders is a very salient one and very contemporaneous. There are a few other things I'd like to mention, particularly regarding symposia. I'd like to mention as well. One focuses on adolescent alcohol consumption and adolescent alcohol use disorders. A very nice aspect of this symposium is that the presentations incorporate a developmental perspective into the presentation. Another topic of interest is a symposium that focuses on borderline personality disorder in adolescents and the complex issues associated with this very vulnerable patient population. Now, besides the activities I've mentioned, there's also symposia that consider eating disorders and others that involve new onset patients or patients with new onset psychotic illnesses. Certainly topics that are important for those who work with teens and their families. In short, there's quite a bit to choose from when deciding what to attend at the American Psychiatric Association annual meeting, and that's certainly a strength. For those of you like me who are lucky enough to attend this meeting, I certainly do hope you enjoy your time in San Francisco and have a very productive meeting. Please feel free to comment on what I've talked about today by clicking on the Discuss link button located beneath this video screen. I'm Dr. Robert Findling, and I'd like to thank you for watching.